Here are 4 images of the fetus in first and second trimester. 2 of the images are of male fetus and 2 are of female fetus. Can you guess which one is male and which one is female child? If not, then this video is for you. In this video, I am going to talk about how to identify fetal gender using ultrasound. By the end of this video, you will be able to determine fetal gender during first, second and third trimester. So without further delay, let's begin. First of all, keep in mind that revealing a baby's gender is illegal in some countries like India, Nepal and other South Asian nations. Always make sure to follow the laws in your countries regarding this matter. Now let's proceed to the video. Fetal gender can be identified correctly from late first trimester onwards. In late first trimester, fetal gender is identified by analyzing the direction and orientation of genital tubercle in mid-sagittal plane. In second and third trimester, fetal gender is identified by looking at the external genitalia of the fetus. Genital tubercle is a fetal structure which has a potential to develop into male sex organ penis and female sex organ clitoris. Genital tubercle develops early in the development, in around 4th week of gestation. However, it looks similar in both sexes until late first trimester. Here are 2 images of the fetus. One is of female fetus and another is of male fetus. How we actually identify the fetal gender in first trimester? The simple answer to this question is by observing the direction of genital tubercle. In grayscale ultrasound, genital tubercle can be identified at the caudal part of the fetus. Here in this image, this is the fetal head and here is the fetal spine. Similarly, you can identify fetal head and spine in second image easily. Once you identify the fetal spine, you should follow the spine caudally. On the caudal part of the fetus, where the spine ends, you can see a small protrusion. This protrusion is located in the region from where the fetal legs should normally arise. In ultrasound, genital tubercle appear white in color. It means genital tubercle is an echogenic structure at the caudalmost part of the fetus. Once you identify the genital tubercle in ultrasound, you should look for its direction. Please note, downward tubercle indicates a female fetus, while an upward tubercle indicates a male fetus. Alternatively, fetal gender can be identified by measuring genital angle. For measuring genital angle, one line should be drawn along the lumbosacral skin and another line should be drawn passing through the genital tubercle like this. If the angle between these 2 lines is more than 30 degrees, this confirms the male fetus. Alternatively, if the genital tubercle is facing the fetal head, this represents the male fetus. On the other hand, if the angle is less than 10 degrees, then this indicates female fetus. If the genital tubercle is parallel to the lumbosacral spine, or if it faces away from the fetal head, then this indicates female fetus. In first image, the genital angle is less than 10 degrees. So first one is of female fetus. On the other hand, the genital angle is more than 30 degrees in second image. So second image is of male fetus. In next few slides, we will see various directions of the genital tubercle and we will try to identify the gender of the fetus. In first image, the genital tubercle is parallel with the lumbosacral line, making genital angle less than 10 degrees. Additionally, genital tubercle is facing away from the fetal head. Hence, this is a female fetus. In second image, if we measure the genital angle, it will be more than 30 degrees and genital tubercle is facing towards the fetal head. So this is a male fetus. The genital tubercle can be identified as early as day 55 using ultrasound. The gestational period during which fetal sexing is most accurate is from 60 days to 80 days. Before 60 days, the fetus may not be adequately developed for fetal gender identification. In second and third trimester, male and female fetus is identified by direct visualization of the external genitalia. They are penis and scrotum in male and labia majora, labia minora and clitoris in female. Radiologically, visualization of the total sign indicates male fetus, while visualization of the three-line sign or hamburger sign indicates female fetus. In next few slides, we will learn about these signs in detail. In ultrasound, visualization of turtle-like structure in perineum of the fetus indicates male fetus. Head of the turtle is made by penis, while body of the turtle is made by scrotal sac. Visualization of the penis and scrotal sac confirms the male fetus. Here is an ultrasonographic image of a fetus of 17-week period of gestation. Here in this image, we can see a bulging elevated structure representing the head of the turtle. So this is penis of the fetus. At the base of this elevated structure, there is another bulging representing the body of the turtle, indicating scrotal sac. Hence, this is a male fetus. Similarly, here are few more images to demonstrate the male fetus. In both of these images, you can see penis and scrotal sac. So both of these images represents male fetus. Visualization of three-line sign or hamburger sign indicates female fetus. Three lines are formed by two labia and central clitoris. In hamburger sign, the bones of the hamburger represents the labia, while central meat of the hamburger represents the clitoris. Visualization of labia and clitoris confirms the female fetus. Here in this image, you can see three echogenic lines in perineal region of the fetus. This also mimics hamburger, representing labial folds and clitoris. Hence, this represents female fetus. Here are few more images showing central clitoris and peripheral labial folds, indicating female fetus. Failure to visualize male genitalia is not sufficient to diagnose a female fetus. Inappropriate fetal position, oligohydramnios, maternal obesity, and operator inexperience represents the major limitation in gender identification. When conventional method fails, fetal sex can be assigned by ultrasonographic evaluation of pelvic organ in second and third trimester of pregnancy. Testicular descent into the scrotum occurs after 25 weeks. If we can see the fetal testis in abdominal cavity, this can confirm the male fetus. Similarly, visualization of the ovary confirms female fetus. Gender identification is difficult in case of ambiguous genitalia. In a male fetus, features of ambiguous genitalia are micropenis, penile chordae or abnormal curvature of the penis, bifid scrotum, and undescended testis in third trimester. A male fetus with micropenis, bifid scrotum, and undescended testis may not be distinguished from virilized female who has clitoral enlargement. If ambiguous genitalia are suspected, karyotyping is obtained to determine the genetic makeup of the fetus.